Israel is known to be very technologically advanced, with new and high-tech developments taking place on a daily basis. It appears that Israeli medicine has gone digital as well. The Israeli Health Ministry has issued a new protocol in which doctors will be allowed to prescribe medication, write sick notes to patients, and refer them to specialists and hospitals, all via the internet. It's called telemedicine.
Telemedicine is becoming a very popular meme, and it's being used both by physicians as well as patients. Every time you call your physician and you ask him a question, he's a telemedicine. As well, of course, of using more sophisticated means, such as transmitting pictures and asking a person's physician or other medical professional for his advice. We are advancing in medicine, but we are advancing carefully and keeping patient security on the top of our worries.
The most complicated issue is the lack of medical staff. What we did is we established a video conference between professional centers that we have in Israel, like this one in Tel Aviv, and between branches that we have in small towns in the periphery areas. What's amazing about video conference is that you don't always need a feedback by speaking. You can see the face of the patient speaking with a doctor in Tel Aviv while sitting in Eilat or in Be'er Sheva or in Arad.
And while physicians and hospitals are working with the government towards regulating these plans, Israelis seem to be very excited about the option of telemedicine.
I think it will be a great tool, a very helpful tool for all those people that live in the periphery, and it will be a great thing for them, people that not able to come to the doctor, that people that have difficulties, disables a lot of things. It will be a great tool for them.
Usually we don't have the time during work hours to drive to the doctor and get the approvals we need and the information we need. So it will be very good service to use to save time and money, and it will be great.
It's just like meeting the doctor without meeting him face-to-face, but with meeting him in the television. It helps people every day. I was a witness of a conversation between a couple from a very small town with a physician sits in this center. And they told him that when they take the right doses of the medicine, they feel bad in their stomach. I saw this conversation, and 2 weeks later, a conversation that they're saying that everything is okay, and everything, as I said, is documented in the in the computerized medical record.
It's evident that there are many issues to be worked out, mainly the various security issues that can be encountered online, which will require web security systems implemented, work protocols, and special training for doctors, along with patient responsibility with sensitive materials. But as far as Israel's concerned, the long-term goal is clear: to have the entire Israeli medical system digitally in sync.
In the future, we are trying to combine together in one net all the hospitals of Israel. That's our future, that's our goal as Ministry of Health. When we'll be able to do so, it will also benefit our patients, and they'll be able to come to one institute and get, for example, their history from all the other institutes, and the physician will be able to see all this history and give the right advice, the right medical advice to our patient.
For JN1, I'm Sivan Raviv, Israel.